Welcome to Fast Physio Facts with me, Mick Hughes, episode number 4 today, and this one's a beauty on proximal hamstring tendinopathy, or that deep buttock pain you get when you sit or when you run hills. Now this paper was called Physiotherapy compared with shockwave therapy for the treatment of proximal hamstring tendinopathy, a randomized controlled trial, and was led by a wonderful research team led by Aidan Rich and his colleagues based at La Trobe University here in Melbourne, Australia. And this paper was published in the American Journal of Sports Medicine 2025. This was a multicenter, assessor-blinded randomized controlled trial across 10 different clinics across Victoria in Australia, and they recruited 100 participants and randomized them to either receiving individual physiotherapy or shockwave therapy to their painful tendon. Participants' age range from 18 to 65, and they all had to have at least 3 months of gradual onset localized lower buttock pain that was consistent with proximal hamstring tendinopathy. The sample was mostly female, with 74% of the group being female and the average age being about 45. Average pain in the last week was considerably high, so on average it was roughly about 4 out of 10, and then the worst pain actually elevated up to about 6 out of 10 on average across the group in the last week as well, being the worst pain. Now the interventions we had a group that had 6 individualized physiotherapy sessions over 12 weeks, and then we had the shockwave therapy that had 4 sessions of shockwave therapy that was bookended with an initial consult and then education session at the end. So both groups received the same amount of care, so 6 sessions each, but with the treatment in between was the difference. So the first session was a bit longer than the others, but they all had the same amount of care. The shockwave group received 4 sessions of shockwave with 2,000 shocks per session at a maximal tolerable intensity, and no exercises were performed or prescribed to complement the shockwave. Their later sessions, though, did include some review and return to activity planning. The physio group had individualized and multi-stage progressive strengthening program added from session 2. And it also included a gradual reintroduction of compressive loading to the proximal hamstring tendon. Now, both groups received, importantly, the same standardised education and advice, and the same advice around pain monitoring during activity, with the participants told to try to avoid pain of greater than 4 out of 10 during exercise, with no meaningful flares the next day. The main outcome looked at by the authors at the 12-month mark was the global rating of change on the VISA H score, which is a hamstring tendinopathy pain and function score. The big headline result here that we all want to know is, was shockwave therapy or individualized physio care better than the other? And the answer is no. There was no meaningful difference between the 2 interventions at any time point. Importantly, over the course of the 12 months, there was no differences between the groups. Both groups, though, however, and this is important to note, that both groups did get better with both shockwave over time, or after that intervention period, or individualised care over that period of time. So at baseline, they all turned up to physiotherapy with about a 50 out of 100 score, so 50% score on their VISA H. At the end of 1 year, so 52 weeks, their average VISA H scores was 74. So big improvements over time, but no differences between the groups. When it came to pain, pain improved significantly in both groups as well. So that's often a key measure that we all want to know is, did pain get better as well as function? So the worst pain at baseline was 5.5 to 6 out of 10, as we just mentioned. By 4 weeks, that had dropped down to 4 out of 10. By 12 weeks, down to 2.9 out of 10. By 6 months, 2.6 out of 10, and by 1 year also hovered around 2.6. So big changes in the first 3 months, and that makes sense with the intervention period being at the start of the session. So worst pain dropped quite significantly, and average pain, same thing, followed a similar trend that it started out at 4 out of 10 at baseline, dropped to 2.7 after a month, dropped to 1.7 out of 10 by 3 months, and then sort of plateaued at 6 months and 12 months of that same score. So clinically, we're seeing a moderate amount of pain significantly reduced down to low amounts of pain by 3 months, and then sustained all the way through to 12. When it came to adherence and satisfaction from the participants, the shockwave therapy had a small edge at certain time points on a satisfaction scale. So at 26 weeks, so 6 months post-intervention, people were more satisfied with the shockwave therapy compared to physio. And satisfaction with results also leaned slightly towards shockwave at 4 weeks and 6 months as well. But by 12, so 3 months and 1 year, the satisfaction was fairly even between the groups. And one likely explanation here was the adherence of the shockwave therapy was slightly higher in the shockwave group to treatment as opposed to the individualized physiotherapy group. Probably because it required less time and effort to turn up and just get shockwave treatment as opposed to going out and doing your progressive loaded strengthening program. So that's potentially something that the authors found there. So what does this mean for practice? Like we're basically faced with two treatment outcomes here. Two treatment choices here for proximal hamstring tendinopathy, and the results are the same. So both treatments effectively are very reasonable choices for our patients presenting with proximal hamstring tendinopathy, and we can expect improvements in pain and function after 3 months, and certainly sustained through to 6 and 12 months. So it kind of lends itself to whatever treatment choice sits with the patient better, and match the plan to the patient. So if the person is time poor and not that big of a fan of going to the gym or doing anything that's really progressive and overloaded and impedes on their time, then shockwave therapy is a pretty reasonable option for them to get an improvement in their pain. But if you're doing rehab and you're doing exercise and they're enjoying it and actually love doing that, then that's your treatment choice too. So that's probably the big takeaways from me, is that we've basically got two effective treatments here that yield good outcomes. And I guess the decision to go one path over the other really comes down to the person sitting in front of you. So just take that in mind. Last one is that this participation group and the individuals here were middle-aged, recreational, mostly female. So just be careful when you generalise. You may generalise some of this information to a different age or a different sex. Just be careful. We may not be seeing the same results in a different audience. So that's Fast Physio Facts with me, Mick Hughes, today. Episode 4 done and in the books. Like, share, subscribe, do all the things to help this kind of education get out there. And stay tuned for the next episode. Episode number 5 coming at you soon. Until then, see you later.